Is the opioid MME limit really putting our lives at risk? Join me as I dive into the controversial topic of the opioid MME limit. I'm going to challenge myself and find out if these restrictions are really putting our lives at risk. The opioid crisis has been a pressing concern in the healthcare community for years. And the one aspect that's been gaining attention is the MME limit, or the morphine milligram equivalent limit. This metric is used to standardize the prescription of opioids, ensuring that the patients receive the appropriate dosage. But is the limit doing more harm than good? There are many challenges that arise with the MME limit restriction. And one of the most significant concerns is under pain management, when patients are forced to take a lower dosage of the opioid medication. Their pain may not be adequately managed, leading to a decreased quality of life and even an increased risk of addiction. And patients who build up a tolerance over time may require a higher dosage to achieve the same level of pain relief, which can be difficult to obtain under the MME limit. Another issue is that the MME limit can be overly restrictive, leading to a one-size-fits-all approach to pain management. And this can be problematic for patients with complex or chronic pain conditions who may require a more nuanced and flexible treatment. By limiting the amount of opioids that can be prescribed, healthcare providers may be forced to choose between under-treating their patients' pain or risk over-prescribing and potential addiction. The consequences for patients relying on these medications can be severe. Imagine living with chronic pain when your doctor's forced to taper your medication to the MME limit. The resulting symptoms can be brutal, and the loss of pain relief can be devastating. It's not hard to see how this could lead to feelings of hopelessness and despair. The MME also raises questions about the role of the healthcare providers for pain management. Should they prioritize pain relief, even if it means a potential for the risk of addiction? Or should they err on the side of caution, potentially leaving patients to suffer unbearable pain? The complexities of this issue are undeniable, and the MME limit only adds to the challenge. When it comes to the opioid prescribing guidelines, there's a delicate balance to be struck between providing adequate pain relief and minimizing the risk of addiction. However, the nuances of the guidelines have been lost in translation, leading to be overly restrictive of the MME limit that prioritize safety over patients' needs. Now, this is especially true when we consider the patient who are already reliant on opioids are often stigmatized and marginalized, making it even harder for them to access the care that they need. The impact of the MME limit on the patient's quality of life cannot be overstated. Imagine living with chronic pain and being forced to choose between tolerating excruciating pain or risk addiction to gain some semblance of relief. It's a vicious cycle, and the MME limit only exacerbates that problem. By prioritizing safety over patients' needs, we are potentially condemning patients to the life of suffering. They argue the MME is necessary for overprescribing and addiction, while others believe that they are overly restrictive and prioritize safety over patients' needs. Is there an easy solution? One thing is for certain. We need to prioritize our patients' well-being above all else. One story that drives it home. Sarah, a 35-year-old mother of two, diagnosed with 4-stage cancer. Undergoing chemotherapy, Sarah was left with debilitating chronic pain. It made everyday activities a struggle for her. Her doctor prescribed her opioids to manage her pain, but the MME limit, her dosage was capped, leaving Sarah to suffer through excruciating pain. The emotional toll on Sarah and her family was immense, and it's heartbreaking to think that this is the reality for so many patients relying on opioids. And as the days turned into weeks, Sarah's pain worsened. She was forced to make the impossible choice between tolerating her pain or risking some semblance to get relief. It's a choice that no patient should ever have to make. And that is a stark reminder of the human cost of the MME limit. And Sarah's story is just one of the many. And it's essential that we don't forget the real people behind the statistics. There are countless stories like Sarah. I am also one of those statistics. They are a testament to the devastating impact of the MME limit on the individuals, on the patients. These restrictions are not just numbers on a page. They have real-world consequences. They affect people's lives in a profound way. As we move forward, it is crucial that we remember the human cost of our decision and prioritize our patients' well-being above all else. So yes, the MME limit is complex and multifaceted that requires a nuanced approach. Safety is undoubtedly important, but we cannot sacrifice our patients' quality of life on the altar of caution. It's time for us to re-examine our priorities and find a balance that truly puts our patients first. Thank you for watching. I would love to hear your comments below. Do you think the MME is doing more harm than good? I invite you to share your story and your opinions in the comments. Thank you. Have a good one, guys.